year 19 Category 1 JMHCP grant track. We'll get started in just a minute. We're going to give folks another minute or two to join, and then we'll get started. So hold tight. Thanks. Okay, hey everyone, and welcome to the orientation webinar for the fiscal year 19 Category 1 grant track. Congratulations again on your grant award, and we're very much looking forward to working with all of you. Next slide, please, Eunice. So what will we cover today on today's webinar? So first, we'll do introduction, so you'll know who you're hearing on the webinar. Then we'll talk a little bit about what the Category 1 grant track is. Then you'll hear about the deliverables associated with this grant track and how we, as your technical assistance providers and BJA state policy advisors, can help. And lastly, we want to take some time to hear from you. So I always like to flag this at the start of the presentation, that after we go through all of the webinar content, we will ask each county to select one representative to tell the group 3 things. Number 1, who you are. Number 2, what jurisdiction you're calling from. And number 3, just a really quick, maybe 2 to 3 minute overview of your grant project. So I always like to flag that at the start so you can give it some thought while we're going through some of the content. Next slide, please. Okay, so introductions. These are the folks that you'll be hearing from on the call today. So First up, we have Jessica Yates, who's a business analyst for the Justice and Mental Health Collaboration Program from San Luis Obispo Sheriff's Office. They are currently a fiscal year 18 Category 1 grantee. You'll hear from Maria Fryer, who's a Justice System and Corrections Policy Advisor for Substance Abuse and Mental Health from the Bureau of Justice Assistance at the U.S. Department of Justice. Marilyn Leak, myself, I'm a policy analyst at the Council of State Governments Justice Center. Mark Stovall, who's a senior policy analyst at the Council of State Governments Justice Center. Risa Hanneberg, also from the Justice Center, she's a Deputy Division Director. And Sheila Tillman from the Justice Center as well, who is a senior policy analyst. Great, so now I'm going to hand it over to Maria to tell you a little bit about BJA and the JMHCP grant tracks.
Great. Thank you so much. Welcome, everyone, and we're happy to have you. Want to say first and foremost, again, congratulations on your award. It is a very competitive program, and we know that you've worked very hard in your submission, and we're looking forward to great things from your community. As mentioned, my name is Maria Fryer, and I'm a policy advisor over the Justice and Mental Health Collaboration Grant Program at the Policy Office at BJA. And in my recent past, I have worked at the local level. I've worked as a state administrator. I've worked in county-state partnerships prior to coming to BJA. So I truly appreciate the amount of work that goes into the front-end work as far as JMHCP is concerned in these projects, and we're again just really looking forward to working with you. Now I'm at BJA, and so I oversee the Justice and Mental Health Collaboration Program, along with a number of training and technical assistance initiatives to help support the work that you do at the local level. So thank you again. The Justice and Mental Health Collaboration Program is an incredibly broad program. It covers cross-system coordination through the entire justice continuum, from first contact on through to jails, pretrial services, courts, prisons, and reentry. It really spans the entire justice system. And of course, we promote cross-system collaboration and partnership to serve and enhance treatment for individuals with mental illness and co-occurring mental health and substance use disorders when they come in contact with the criminal justice system. And a major goal of the JMHCP is to facilitate that collaboration and create change at the local level to make system improvements. So thank you again. I just wanted to let you know a little bit more about the Justice and Mental Health Collaboration Program. It does fall into 3 categories. With each specific goal and criteria. In Category 1, that's all of you. This grant program is the smallest of the 3, and since its creation in FY18, there have been 29 total JMHCP Category 1 grants, and 10 grantees in the 19 cohort. So a total of 29. So you're a great group, great and mighty group that are doing wonderful things at the front end of the system. The Category 1 grant program aims to help counties decrease the prevalence of individuals with mental illness in jail and takes a collaborative approach, as I mentioned, and a system-level approach to intervention. We know this may seem like a daunting task, and so as part of the grant, you'll be working with our partner, the Council of State Governments Justice Center, as a technical assistance provider to BJA, and of course you'll be assigned a coach that is there to help you and support you, and we want to challenge you and help you to meet all your challenges at the local community with the best support that we can provide. So thank you again for being on the webinar today. We hope that it's helpful and it's informative, and that all the information is relative to you where you are in the work that you do. So again, thank you, and I just want to hand it back over. Thank you.
Hi, everyone. This is Risa Hanneberg, and I serve as the Deputy Division Director for the Council of State Governments Justice Center. And I just want to, just a few minutes about my role. In my work, I oversee the National Stepping Up Initiative, and I'll be talking about that in a little more detail in the upcoming slides, as well as also provide advising to the Category 1 grant track. And I just wanted to say that personally I'm super excited. I've been involved with this grant track since the inception in 2015 and have worked with all 29 of the sites now. And we're bringing a great team on board here to work with each of you and work with you in your very many different deliverables and accomplishments that you'll be working on. Next slide. So just a little bit about the Justice Center, and I want to thank Maria for pointing out that we are partnered with the Bureau of Justice Assistance. Many times on the calls, we might be referring you to check back with your grant contact at the BJA for some of the questions that you might have, particularly if they're involving budget or financial. It is our role to be advising you on the actual implementation of your grant deliverables and expectations. At the Justice Center, we really have a specialized approach. I like to think that we have built quite an expertise in the crossroads of criminal justice and behavioral health. We like to think that we work hard to bring people together. We work very hard on being up to speed on all the current and original research and all the connections and resources that we can provide to you to assist you in your project. We hope that we can build momentum for policy change, which is really what this grant track in particular is about, and to provide that expert assistance. Next slide. So our goals at the Justice Center, overall, our mission, if you will, is to break the cycle of incarceration and improve health, opportunity, and equity, and to expand what works to improve safety. And again, I feel that we really work hard and strive to be experts in the particular nexus between behavioral health and criminal justice. Next slide. So a little bit about the Stepping Up Initiative. First, I hope that you and your community have passed a resolution and that you are officially a Stepping Up site in the United States. We currently have over 500 counties who have passed resolutions to participate in this national effort to reduce the number of people with serious mental illness in jails. And it is the goal that we'll have fewer people who have mental illness in our jails tomorrow than we have today. And I know from looking over your different grant narratives that this has certainly been a top priority for you and in your counties, and which led you to write your grants. If you have not passed the Stepping Up resolution, I certainly would encourage you to, and your TA provider can assist you in that. And I would also ask that you consider, if you haven't already been to the Stepping Up website, that is loaded with materials and resources that will align specifically with this particular grant track. Next slide. And as I said, we've got over 500 counties now that have passed resolutions. This encompasses 43 states, and I believe we're at 46% of the population. We're extremely excited about the ongoing momentum that the Stepping Up Initiative has been able to maintain. This May will mark the 5th anniversary of Stepping Up, and we're very excited to be rolling out some new efforts and some new targets as far as where the work should head to next. Next slide. And congratulations again to you. If we haven't said it enough today, I myself, my home community in Johnson County, Kansas, I was a recipient and the grant writer for not for Category 1, but for a JMHCP grant many years ago. And certainly can echo that it's extremely competitive, and you should be very proud, first and foremost, of yourselves for being awarded the grant. And as I always said, and this is when the work begins. I know it's a lot of work to actually write the grant, but now is when we really roll up our sleeves. As you can see, across the bottom are going to be your cohort of Category 1 sites, and we will be serving all of you, all 10 of you, and at times bringing you together along with the other sites that have already been at this for a year or more, and connecting you and using all of the sites together as one big referral resource. Next slide. And I think I'm going to switch it back to Marilyn at this point.
So yeah, so Sheila is going to talk a little bit about the grant requirements and how we can help.
Thank you.
I'm just going to jump in so that I would take it from here. Thank you, Risa. My name is Sheila Tillman, and I'm a senior policy analyst here at the Justice Center. And one of the hats that I wear is to provide technical assistance to JMHCP grantees. So I was able to provide technical assistance to JMHCP grantees over the past couple of years, and I look forward to working with those of you that I am able to be the TA provider to for the fiscal year 19 Category 1 cohort. So the first step in the grant process is the grantee orientation process. We held the general JMHCP orientation webinars last month. There were 2 of them. Part 1 was focused on an overview of training and technical assistance, and Part 2 was focused on the very important topic of grant management and financial reporting. If you were not able to attend either or one or either of those webinars, or if you'd like to access the recording and the PowerPoint slides, it is posted on our website. Many of you, if not all of you, have connected with your TA provider, and you may have had your initial orientation call or have it scheduled for the next couple of weeks. So if you haven't heard from your TA provider yet or haven't had that orientation call scheduled, I anticipate you will hear from them shortly. The Category 1 specific webinar is the webinar that you are attending today, right now. Like the general orientation webinar, the recording for this webinar will be available on our website. For next steps, make sure you complete the grants financial management training within 120 days of award acceptance. The completion of this training is required for programmatic and financial POCs for the grant. And additionally, begin reviewing the P&I guide. The guide will be sent to you by your TA provider or found on our website. You may not have gotten it from your TA provider yet, but again, I anticipate that you will get it in the next couple of weeks if you haven't received that yet. And I'll talk to you more about the P&I, the Plan Implementation Guide, in a little bit. Now a little bit just to review the grant expectations for Category 1 grantees. Grantees will engage in a collaborative planning process with county leadership toward the goal of reducing the number of individuals with mental disorders and co-occurring substance use disorders in jails who can be safely supervised and/or treated in the community. These grants support a targeted analysis of the prevalence of people with mental disorders in the jail, a review of existing community resources, and identification and initial implementation of policy and practice changes to minimize contact or deeper involvement of individuals with mental disorders and co-occurring substance use disorders in the criminal justice system. Category 1 grantees will demonstrate a commitment to system-level reduction in the prevalence of mental illnesses in jails. Beyond intercept-specific programs, counties will work toward a coordinated response to maximize diversion for individuals with mental disorders that include a county system analysis to identify strategies to reduce the prevalence of individuals with mental disorders in local jails, screening and assessing all people with potential mental disorders booked into the jail for criminogenic risk and needs, recording this information in an electronic record, ensuring this information is shared appropriately to inform pretrial decision-making, and defining mental health needs in terms that align with state definitions that pertain to eligibility for publicly funded mental health services. A key component to making changes to processes or operations within a system is the establishment of a planning team, which includes representatives from county leadership, stakeholders, and decision makers from multiple agencies, including criminal justice, behavioral health, and community-based providers. An additional requirement of the grant is to work with us as your technical assistance provider. We will provide support, guidance, and advice while you work through your grant objectives and requirements, including activities such as the completion of the Plan and Implementation Guide, identifying measures and strategies to track progress, and sharing successes with stakeholders, the field, and press. The training and technical assistance we provide includes a variety of formats, such as monthly technical assistance calls, Planning and Implementation Guide support, provision of helpful resources, connection to peers, learning communities, and the opportunity to meet and speak with you in person during site visits. To hear a little bit more about what our TA looks like from the grantee perspective, I would like to invite Jessica Yates from San Luis Obispo County, California, a fiscal year 18 Category 1 grantee, to speak for a couple of minutes about her experience with technical assistance. Jessie?
Thank you, Sheila. Hello, my name is Jessica Yates, and like she said, I'm from San Luis Obispo County. We are just finishing our first year of the Category 1 grant, and my experience so far is the Planning and Implementation Guide is literally a step-by-step manual on how to be successful in implementing a plan to meet the 4 key measures of the grant, which are the Stepping Up initiative, like Risa was saying earlier. Your technical advisor on the training and technical assistance calls, which will be once a month, are a very useful resource, and this is a dedicated time to take advantage of while you have them during the grant. Some of the resources that my advisor has helped me with thus far are online resources for comparing different screening tools, as well as direction on how to find a validated screening tool, connections to other counties that have implemented programs and policies that we are looking into in order to speak directly with those counties and discuss their challenges and their successes. This is helpful because speaking with peers that have already accomplished the goals that you are trying to hit saves a lot of time and energy and effort. And they have provided examples of MOUs, memorandums of understanding, and contracts that other counties have implemented for sharing data across different departments, which is one of the largest hurdles that you'll probably run into. So that's very important to get an MOU implemented early on in the process. She directed me to resources like the Strategy Lab on the Stepping Up website with links to exact examples of what I was trying to find and accomplish. We discussed items like definitions of recidivism and severe mental illness, co-occurring severe mental illness and substance abuse, and how to come into an agreement county-wide on the definitions in order to streamline within our county, as well as best practices that should be implemented. Really, you don't need to reinvent the wheel. Take the Planning and Implementation Guide, the P&I Guide as we refer to it, seriously and spend time to answer the questions as thoroughly and complete as possible, as that makes the process go more smoothly as the grant progresses. I was able to get a copy from my TA of a completed guide to get an idea of what was expected, which was very useful. It is useful in directing you step by step in what you need to do in order to be successful with your grant. Each and every section defines what you need to do, so my advice is to do it. Skipping a part of the guide will take away a large piece of the puzzle, so take it seriously and it will literally guide you into implementing the steps of the P&I Guide and to be successful in the end. One priority that I have seen other counties not recognize as an important piece to the puzzle is identifying the people who will be on your lead working group, which is crucial to the success of your grant. Without having representation from all the departments that will be involved, it just slows down your process and causes a lot of holdups. Make sure that you have representation from every department and that the representatives not only have working knowledge of the departments, but also have the authority to make decisions. The departments that we have on our lead working group is behavioral health, law enforcement, probation, IT department, the courts, the district attorney, the public defender, as well as our county administrative office. The training and technical assistance provided by the Council of State Governments Justice Center is invaluable, so make sure that before the calls start, you have questions prepared and people on the call who can actively discuss those items. Make sure to sign up for the webinars that they offer and get on the email distribution list for SAMHSA, NACO, the CSG Justice Center, as well as Stepping Up. And your TA can help you with that if you aren't familiar with those groups. The site visit is something that you should start preparing for a few months in advance. Make sure to get it on your calendars of not only your stakeholders within your county departments, but also your community partners. We toured our jail, our psychiatric health facility, and our crisis stabilization unit. And while at the jail, we went through our booking process. We also presented to our steering committee as well as our community partners during that time. You want to use that time you have wisely in meeting. Don't schedule things that don't maximize their time, as they will take notes and inventory of what you are doing and will give you suggestions and help you find gaps and needs within your programs that will help you be successful with your grant. The site visit also is beneficial in that when they come, if there are any stakeholders within your county departments or community partners that are blocking or hindering your progress, which happens, we all know, you can schedule a presentation and make sure to have your representatives from the CSG Center address their concerns and questions. because having an outside source tell someone what is expected of the grant sometimes goes a long way and helps to take down those barriers. The JMHCP grant gives you great assistance and direction in order to support change in your community. The strategy lab, the peer-to-peer discussions that can be set up with your TA, the P&I guide step-by-step process, and the site visit all work in tandem to help direct you towards change. You need to utilize all of the resources available, and again, I cannot stress enough making sure to convene a working group with representatives from all of your departments and community partners involved. You need to make sure everyone knows and understands that collaboration and understanding that everyone is on the same team is the easiest and best way to bring forth change and progress within your communities. Also, start off meetings saying that the JMHCP grant is successful only through that collaboration, hence the name of the grant, the Justice and Mental Health Collaboration Program. I'm more than happy to answer questions and be a peer-to-peer resource for you during your grant process. Just ask your TA to help you make that connection with me, and I can be here for you. So back to you guys.
Thank you so much, Jessica. I really appreciate that.
You're welcome.
Just a couple more items to note about the grant, and then we're going to talk a little bit more about the Plan and Implementation Guide. The Category 1 grantees will initially have access up to $100,000 of the total grant award. To access the remaining funds, a determined portion of the P&I Guide will need to be completed, submitted, and approved by BJA. Your TA provider will provide additional information on this. The remaining sections of the guide will need to be completed by the end of the grant to close out your grant award. So just to underscore that, so the P&I Guide is a grant requirement, and in order to close out your grant award at the end of your grant period, you will need to have it submitted, completed, submitted, and approved by BJA. Your TA provider will provide a suggested timeline for completion of the P&I Guide that reflects these benchmarks. And if you have additional questions about this, please feel free to ask today, or again, your TA provider will be available to answer these questions for you. There are two phases of this grant: planning, which occurs in the first 8 months, followed by the implementation phase. The majority of the P&I Guide will be filled out during that planning phase in the first 8 months or so. The last thing I want to note in terms of requirements for the grant is PMT reporting. PMT reports are required to be submitted quarterly. If you have any questions about PMT or the PMT reporting process, please reach out to your BJA advisor or the PMT helpline. If you need that information, your TA provider can send that to you as well. So as previously mentioned, the completion and submission of this guide, P&I Guide, is a grant requirement. Even though it is a grant requirement, this guide was designed to be a tool to be used during the planning phase for grantees to work through the planning phase, and we really hope that you find it useful, because it was definitely developed thinking through the planning phase and what would be most helpful for grantees. The guide provides exercises to help you move through the planning steps, such as identifying with people with mental illness in the criminal justice system, identifying appropriate services, identifying connections to care, and ensuring the right folks are receiving the right level of treatment. So how is the P&I Guide used? In addition to assisting grantees through different process elements through the use of exercises in the guides, grantee responses will also help us identify what grantees are doing well in their system or challenges grantees may face, which helps us to create opportunities for peer-to-peer learning and provide targeted technical assistance. Jesse, I'm curious if you could speak a little bit more about, you already touched on this, but I was wondering if you could speak a little more about the process and impressions of working through the guide. I know that you all in San Luis Obispo found it to be a helpful planning tool. I was wondering if you could maybe just talk a little bit more about that for us.
Yes, I believe that the Planning Implementation Guide, literally, if it's not used or utilized, it's a big waste to not use that. We were able to. I didn't come from a government or a mental health background or anything like that, but I was able to come in and just start going through the guide, which not only helped our county but helped me to really direct what to do with the grant. So a lot of times, I know you get the grant, you have an idea, but there are so many things that are encompassing the grant with so many goals. Even though there's only 4 key measures, there's really 16 sub-measures, so it's a lot to wrap your arms around. And using the planning implementation guide was step by step, like, okay, number one, just start here. Number two, go here. So it was a map that basically was like your GPS, and you put in your start point and your end point, and all you have to do is follow the P&I guide, and you're going to get to your goal. Some people I know, they'll start doing it, and then they don't, and then you get off on a side road, and finding your way back is really hard. And sometimes, you'll be wasting a lot of money and resources and things that aren't productive. The planning and implementation guide clearly defines what needs to be accomplished in order to meet these goals. Again, like I said, don't reinvent the wheel. They have laid it out for you. And in following the P&I guide, we are a Stepping Up Initiative county, but in implementing those items, and we also became one of our county, an innovator county for Stepping Up, just because we follow the implementation guide. And so it really will help you be successful, and I cannot stress enough how important it is to not only fill it out, but actually do what it says. If there's a section that you're not currently doing, like having a countywide definition for severe mental illness, don't just say we don't have that. Go and make that happen, so that each section, if there's something you're not doing, you're able to go back and fill in and say that you're doing that section of the P&I guide.
Thank you so much, Jessie. Really appreciate your thoughts and insight, and certainly advice and guidance for this new cohort of grantees. And also appreciate you offering to connect with any of the new grantees if that would be helpful for them.
Anytime. You're welcome.
All right, I'm now going to turn it over to my colleague, Mark. Mark?
Great. Thank you, Sheila. So, hi, everyone. I'm Mark Stovall. I'm a Senior Policy Analyst here at the Council of State Governments Justice Center. And I'm going to talk about some of the resources available under the Stepping Up initiative, starting with what we call the 6 Key Questions Framework. And this is really the foundational framework of Stepping Up, and it gives counties a way to structure their efforts in reducing the number of people with mental illnesses in their jails. And you'll notice that the P&I guide that Sheila and Jessie talked about incorporates the 6 key questions and operationalizes this framework. And so question 1 asks, is our leadership committed? Has the county passed a Stepping Up proclamation? Is there a planning team with representation from various county agencies involved in criminal justice and behavioral health initiatives? Question 2 asks if there is timely screening and assessment. Is there a system-wide definition of serious mental illness so that everyone is speaking the same language when it comes to understanding who in their systems has mental illness? Is a validated screening tool used to identify mental illness? And is screening conducted universally on every person booked into the jail? And then are people who are screened positive, are they referred for clinical assessment within 72 hours after screening positive? Question 3 asks if there is baseline data available on the 4 key measures of Stepping Up. The number of people with mental illness who are booked into jail, their average length of stay compared to the general population, connections to treatment in the community, and the recidivism rate for people with mental illness. And our reports on this data generated regularly. Question 4 asks if a comprehensive process analysis and inventory of services has been conducted. And these reports take stock of what's available across systems and what's missing, and how people with mental illness flow through different systems. Often counties will do these analyses and inventories in partnership with a third-party facilitator or technical assistance provider, and possibly do a brand name process such as sequential intercept model mapping, which you may have heard about. And question 5 asks, after the processes and services have been identified, have strategies and recommendations been prioritized so that there are detailed descriptions of the need for each recommendation and estimates or projections for each recommendation? And I should mention that the Stepping Up initiative is currently working on a brief that explains the prioritization process and gives some practical tips for how to go about prioritizing. And as your TA providers, we can send a link to that brief once it's available. And then question 6 asks if progress is tracked. So what is the plan for reporting progress on the 4 key measures and our implementation and program impact evaluated? And so this slide shows some of the 4 key measures for the Stepping Up initiative. The recommendations and selected interventions should be grounded in how they will address these 4 key measures: the number of people who are booked into jail who have serious mental illness, their average length of stay, their connections to treatment, and their recidivism rate. And a primary goal of Stepping Up is to increase the number of counties that have access to baseline data on people with mental illness in their system through what we call our innovator counties, and of which San Luis Obispo is one of them. You'll notice that the criteria for being an innovator county come from some of the considerations that I mentioned under the 6 key questions. Having a shared definition of serious mental illness, validated screening done universally, and follow-up assessments, and tracking the data electronically. And this slide shows a map of innovator counties across the country. We currently have 17 of them, and we want to add more stars to this map. And we look forward to working with all of you through your grant programs and more about your efforts to accurately identify the population of people with SMI in your jail systems. And then these are some additional resources to help counties implement the 6 key questions framework in their jurisdictions. We have a project coordinator's handbook that provides some practical tips and strategies for stepping up project coordinators, for going through the 6 key questions with their stakeholder groups, offering some facilitation tips for managing the planning process, and exercises to establish an efficient planning process. We have a series of briefs that are focused on the 6 key questions, such as screening and assessment, collecting and analyzing baseline data, conducting a comprehensive process analysis, and soon to be the brief on prioritizing funding, policy, and practice improvements. And we also have an online county stepping up self-assessment tool, which we fondly refer to as the SUSA tool. And counties can create an account and track their progress on implementing the 6 key questions framework in their jurisdictions. And counties that use the tool will have access to online resources to help advance work in areas where they haven't yet made progress. And we're currently adding some technical changes to the tool that should improve the user's experience. And we also host webinars every quarter, and the most recent webinar was just this past week and was part of a series with the Data-Driven Justice Initiative, looking at both data integration and focusing on the population of high utilizers in county systems. And we also host quarterly network calls for counties based on their size, whether they're rural, urban, or mid-size. And we have additional case studies featuring counties' work on the 6 key questions. And finally, we launched the Stepping Up Strategy Lab earlier this year, and it's an online interactive library of programs, policies, and practices, the different interventions that counties have used to reduce the number of people with SMI in their jails. And this can range from crisis stabilization centers, a decision matrix to inform pretrial release plans, and forensic assertive community treatment, or FACT, teams. And there are more than 100 examples listed here, and we update this every 6 months to ensure that it's reflective of what's happening in the field. And so now I will turn things over to Marilyn.
Yeah, thank you, Mark. And thanks, everyone. Jesse, it was really great to hear some of your insights about the technical assistance and how you've been able to use some of these tools. Okay, so now we would like to hear from each of you. This is the section that I mentioned before, where we're going to ask you to go through grantee by grantee and introduce yourselves. So, like I mentioned before, we really hope that you can all learn from the work each other is doing, and we really hope to make many peer learning connections over this grant period. So to me, this is one of the coolest things about the Category 1 grant track, that the grant projects are all based around the Stepping Up initiative, and so many of the sites are working on similar goals and projects. So as a result, I've really found that peer learning connections are particularly useful among Category 1 sites. So we really hope this exercise will be a good catalyst to start this process. So, as you're listening to others on this, to others in your cohort, make sure to note any sites that you may want to be connected to learn more about their project. So for the next half hour or so, we'd like to hear from you. So as I mentioned before, I'm going to call on each grantee. When you hear your site, we're going to ask that you select one person from your jurisdiction to tell us, number 1, who you are, number 2, what jurisdiction you're calling from, and number 3, a quick, like I mentioned, just about 2 or 3 minutes overview of your grant project. I will say in just a minute we're going to open up the lines, and I will ask that everyone please make sure that your phone is on mute when you're not speaking, because there are a number of folks on the call, since we do have 10 counties, and there may be some interference. So just a quick note, please, everyone check that your phone is on mute. And then I will ask Eunice to go ahead and unmute all the lines. Okay, great. So I have listed the counties or the grantees just alphabetically, so I'm going to run through them. So let's start with the 36th district in Michigan.
Hi, good afternoon. This is Laura McLaughlin with the 36th District Court, which is located in Detroit, Michigan. So most of you are familiar with Detroit in the sense that it's a pretty large city, so definite urban setting. The initiative really is very focused, and what drove us to pursue the grant is just like everybody in the country, there's no room at the inn, and the glaring thing that we couldn't turn our eyes away from was that this population being incarcerated when that just wasn't the right place for them. Our county had begun a process, even sequential intercept mapping, and the county has had a mental health court at the felony level, but not at the misdemeanor level. And so that's what brought us into the loop, because a lot of the folks that were being sort of repeat offenders and cycling in and out of the jail were misdemeanors. So that, in a nutshell, is something we're after. What we're hoping to do, lastly, is to pursue this in a pre-plea fashion, which has been different, so that when we not only restore folks to being some compliance with mental health treatment, it'd be fabulous if they walked away with no conviction if they successfully complete the program.
Great. Thank you, Laura. Okay, so next up we have Bureau County, Illinois. Anyone on the line from Bureau County?
Yes, good afternoon, everyone. My name is Sharon Schauhorn. I am the county administrator, but I'm also the financial point of contact. And we're a rural county with about 32,000 residents, and there's just a need for this type of a project in our area. Our county deputies and also our city police are always inundated with calls with individuals with mental illness, and like the previous speaker, it's just a continuous cycle all the same time, and our emergency rooms also are populated with these individuals. So we're just looking to try and remedy or in fact ease these pressures, and then find some outlets to help these individuals who are in crisis.
Wonderful. Thank you so much, Sharon. What about Chatham County, Georgia?
Good afternoon. This is Sarah Jennings. I'm from Chatham County. I am the Strategic Planning Administrator, the Programmatic Point of Contact. I have on the line with me Commander Friesman and Charity Coyer, which are our project coordinator for our project here. We are referencing it as Breaking the Cycle. We started this work back in 2016 by submitting a resolution, but we didn't actually get active with it until 2017. Some work to be able to begin the process. We've done the assessment and some other things which identify gaps in our community. Earlier this year, we actually had the sequential intercept mapping exercise in partnership with SAMHSA and the Gaines Center. And primarily what we'll be working on with this project is to coordinate the data across various systems in our community to be able to look at how people are being serviced and how we can improve that process, starting with an evidence-based screening and assessment tool at the detention centers. Chatham County is home to Savannah, so we're very historic here. Things take a while to change. Our population is about 298,000. Jail houses, I think the capacity there is around 2,200. And the sheriff indicates that we have about 450 with mental illness in the jail on any given day.
Wow, yeah, great. Thank you, Sharon. I will say that, you mentioned coordinating data across systems, and this is really a hot button topic. I mean, we're hearing it over and over again with a lot of the grantees, and I think there are a lot of folks working on similar projects. So, down the road, once you kind of get into the meat of the project, I think I'm actually your assigned TA coach, so we can talk a little bit more about some peer connections and different other sites that you may want to be connected with to hear what some other folks around the country are doing in that regard.
Thank you.
How about Forsyth County? Forsyth County, if you're talking, we can't hear you. Okay, so we'll skip Forsyth and we will come back. Let's see, next up is Fort Bend County, Texas. Anyone from Fort Bend? Indianapolis?
Hello.
Hi.
This is Carlette Duffy. I am the Director of Reentry for the City of Indianapolis. And for this program, I am the project manager, I do the programmatic side of it. So we received JMHCP funds in 2015, and with those funds, it helped us to start the very first ever, it's the Rubin Engagement Center. And for us, it was kind of a fix for individuals who were seeking treatment but were actively using, because they could not go into treatment while actively using, and to fund any of the currently operating facilities for them to be able to dry out. My terms are just escaping me right now. I need more coffee. But anyway, so this was a place for them to go that was free of charge. And it has operated for the last 3 years, and it has been phenomenal in terms of what is provided to the community. So for sustainability from that, Grant City has chosen to invest in an even larger facility. So our city is building a new criminal justice complex, and one of the buildings on that complex is going to be called the Assessment and Intervention Center. So this will be a facility that's connected to the new jail, and it will allow for individuals who are assessed at the jail as having mental health issues or substance abuse issues or co-occurring mental health and substance abuse issues to be diverted in lieu of incarceration to the not the Rubin Engagement Center, but now the Assessment and Intervention Center. Yeah, that's about it.
Great, thank you, Carla. Did I get your name right? It's Carla?
Carlette.
Okay, Colette, great. This is another topic that's really a hot button topic. I mean, we're seeing lots of these types of programs that fall kind of under the general crisis stabilization unit, although they take lots of different forms. But again, this seems like it would be a good opportunity for some peer learning connections for some sites that are doing similar work. So just let your TA provider know, and we can definitely make those connections.
Excellent.
Thank you. How about Lucas County, Ohio?
Hello there. This is Carolyn Gallatin. I'm with the Lucas County Mental Health Recovery Services Board. Lucas County is better known as Toledo, Urban County. We're Congressional Districts 5 and 9. We're focusing on a diversion program, a actual place where people can be taken instead of the jail that most likely just need treatment. So that is our focus. And a lot more I can say, but I can just add that one of our challenges has been the coordination of sharing of data across systems, especially from hospitals. So we're looking at some things to improve that.
Great, Carolyn. Thank you so much. How about Mendocino County, California? Mendocino County, anybody from Mendocino County? Okay, what about Pickens County, South Carolina?
Hello, this is Sheriff Rick Clark from Pickens County. Can you hear me okay?
We can hear you loud and clear.
Great. The one thing that started off with us when I came into office in 2013, our jail was about 45 years old, and recently we just had a new jail built, but back then we were rated for about 93, and sometimes we would have 200, 230 in there. So it was very quickly that we started working with the community, and we've developed a great team over the past few years. We've started off with building the new jail. We started off with the federal system of looking and analyzing everything through the CJJC, and so that was a big move forward. We pulled our community partners together. So from there, we've most years tried to apply for the grant. Some things would fall apart. Some politics got in the middle of things, but now we're moving ahead. I think one of the things that's been great for us is we changed the narrative on mental health in Pickens County, where everybody now admit that we have mental health issues, and the worst of it is in our jail. So our mental health, behavioral health, all of our community partners, judicial system, everybody has come together, and that's one of the main reasons we've got the grant. And with all of our community partners, that we're moving forward and believe this is going to be the best for us. We've been trying to do this for several years now, and we weren't ready to do it in the past, but everything has come together, and we got a great team, and we're moving forward.
Great, glad to hear that. All right, so last but not least, we have Waukesha County, Wisconsin.
Hello, can you hear me?
Hello, yes we can.
Oh, excellent. Okay, my name is Danielle Verdeau. I'm the coordinator for Crisis Intervention Services for Waukesha County. I'm here with our Justice Services Coordinator and our Fiscal Analyst, who is, the three of us are key internal people within our county Health and Human Services Department for this project. We also participate in a larger group of our Criminal Justice Collaborating Council that has a mental health work group, and that mental health work group is the group, collaborative group in our county that's going to be facilitating and helping us with this project. So Waukesha County has about 400,000 people. We're the third largest county in Wisconsin. And we have an array of mental health treatment, mental health and substance use treatment services. My crisis intervention team is able to do 24/7 mobile response in the community to assess individuals in crisis. And so we respond everywhere in our county, but we respond to our jail quite frequently. And those are just individuals who are in crisis in jail. So we know there are more individuals in our jail with mental health issues. And we currently have a collaborative relationship with a contract partner in the jail who really helps us connect individuals leaving the jail to mental health services. One of the components missing in our community is crisis stabilization services. So we do not have a stabilization facility. And our crisis program is currently certified through the Wisconsin Department of Health Services and stabilization services are considered an optional component of services in Wisconsin. So this grant project is really going to help us walk through the P&I guide that will also then help us set up stabilization services in our community. The services will first really focus on community stabilization workers. So some more individuals that will be in the community, meeting with people at their homes, helping them to connect to services that are necessary to keep people out of crisis and out of jail. So that is where we are ultimately going with our project, and it will help us really set up the structure we need to one day open a stabilization facility as well. We have a strong CIT collaborative in our community as well, and what we consistently hear from law enforcement is if we had additional stabilization services, it would be really beneficial to them in their work, especially working with people with mental health issues. So that's kind of a very broad overview of what we're hoping to achieve.
Great, thank you so much, and thanks to everyone for that great overview. I do want to pause for any of the counties that maybe we missed. If there's anyone on the line who was not able to speak up, I want to open up the lines now just if anybody would like to chime in. Okay, so I guess the only thing would be to Eunice, have we had any questions entered into the WebEx? And if not, now would be the time to do it. So if you have any questions about anything we've covered today, any of the Category 1 content, any of the technical assistance or the P&I guide, we can answer those now. So you could feel free to speak up or to enter anything into the chat box. Okay, well, hearing none, Eunice, can you go to the next slide? So this is our Justice Center website if you have any questions. And here you also have Risa Hannaberg's contact information, who is the grant track lead. So if you have any questions, if you are for some reason unable to get in touch with your technical assistance provider, her contact information is there. And otherwise, for next steps, if you have not already, I think we mentioned this at some point, but if you have not already had your introduction phone call with your TA provider, you should be having that sometime this month. And we'll just look forward to continued work with all of the fiscal year 19 Category 1 crew. So if no one has any questions, I guess we'll just close a little bit early, and I hope everyone has a great day.
Thank you.
Thank you.
Thanks, everybody.
Thanks all.